Alright, so after being in the recovery room for a few minutes, he's now here in his own room. So he's just sleeping at the moment. He was still very drowsy, but he was awake when he came out from theater. And you've got the monitor screen there if we want to watch telly or order food, play games, listen to radio, do voice calls. So that's actually pretty cool. I've got my bed there, and I've got my own toilet. Tommy has an IV running now. He was given some pain relief earlier, so he'll be comfortable. It was given through his spine just before he left. He's got some fentanyl on standby. I'll be the one staying overnight with Tommy. I'm just glad that he's recovering well from the procedure. I can still hear his voice a little bit hoarse, but that's because they put a breathing tube through his mouth. So yeah, we'll just look after him overnight, see how he goes. So here's Tommy. He's just on a monitoring machine at the moment just to check his heart rate and his oxygen levels for the first 2 hours. He's got an IV on his right hand, and yeah, we've got the fluids running now, and he's got this PCA pump for his pain relief or extra pain relief if in case he needs one. He's also got a catheter in, so I'll just show you. I don't think you can see that here. So he's got a catheter bag. So yeah, that's him. Just feels different, yeah. It's almost 11 p.m. He is still awake every now and then. I think the spinal anesthesia that they gave him is starting to wear off. He has been waking up almost every 15 minutes. Yeah, and he's been moving his legs around, so that means it's probably wearing off. Hello everyone, so it's now April 21st. It's 7 past midnight while my little Bubba is fast asleep. Look at that. He's finally comfortable and calm. Ever since they gave him some Panadol through the IV, the night shift nurse said that He will be having some antibiotics as well for 2 more days. Oh no, it's almost 2 a.m. So I managed to sleep for an hour on the chair, and Tommy was asleep as well until he just started screaming. So I think he was in pain. I just couldn't console him. I couldn't reach the call bell because I was on the other side of the bed. But yeah, they noticed that his SATS probe went off, so the nurse came in, and then they tried to give him some extra dose of fentanyl, and then the machine showed some occlusion somewhere, so they had to look for the occlusion. Apparently it's just somewhere inside the machine. Once the fentanyl started going through, he just fell right back to sleep. So yeah, that was quite hard for him. Okay, so good morning. It's 7 a.m. I didn't have any sleep. I was getting up almost every hour just to comfort Tommy. He's just waking up and crying. I don't know if it's the pain or he's hungry, but they've been giving him some extra doses of the pain relief and paracetamol. Yeah, I've been on the chair most of the night. I was on that bed just for a good full hour, and then he started crying again. Good morning, my love. Okay. Good morning. Hi, good morning. It's 8 a.m. It's now pretty bright in here. One of the nurses just came in to see Tommy, to fix his SATS probe because it's not sticking anymore. And Tommy's a little bit more awake. He's a good boy. Here you go, my love. I know. So breakfast is here. Yeah, just the usual hospital breakfast. So the surgical team just came by. They had to look at his wound. It looks okay, and they're happy. So they also had a look at his bum, and we saw that he had a little bit of poo. So I guess that's one of the reasons why he's not comfortable. So the doctor said that he is just gonna contact the surgeon or the consultant to check when he can start feeding, because I think he's quite hungry. This little boy will behave while mommy eats, right? And then he's gonna watch the asthma action plan. There's no cartoons in there, so I'll just let him watch that. At least there's something moving or playing on the screen. Anyway. So I just changed his nappy. He's much calmer now. I think he's trying to sleep. He's gonna have some antibiotics soon. They just changed the bag for the catheter because it wasn't draining. I think there might be some sediments on the tube, so they had to change it because it wasn't draining into the bag. Ganda yan. Nakadapa. That's good. That's good for you, okay? Oh, look at that face. It's okay. It's okay.
Nainom naman niya para sa ito.
Nakatingin pa siya. Camera? Oh, mukhang gusto pa eh. Pero ito muna. Yay! Second bottle of milk. Yay! Good job, love. Hi, so just to give you guys an update. So today is the first day after Tommy's surgery. He's done a lot of poo. We've changed his nappies for about 5-6 times now since his first one this morning. They also removed his catheter, well, because it was blocked. He's had a wee, a big one, after they removed the catheter. But he hasn't weed since. That was like 11:30 in the morning. We did an ultrasound of his bladder, which only showed 20 mils, so that's not a lot. Yeah, hopefully he does a wee anytime soon, because we're also worried that he might need an IDC back, which we don't want to happen. Okay, so I'll just give you guys an update every now and then what happens overnight. So we'll see.